The November 2025 issue of Developmental Medicine and Child Neurology is out now. The following papers are included in this issue. A narrative review in our series on neonatal cranial ultrasonography examines patterns suggestive of either genetic or non-genetic origins to antenatal brain malformation and injury. Another narrative review highlights a multidisciplinary diagnostic approach to occipital brain lesions in children. A systematic review finds that validation of the gross motor function measure for conditions other than cerebral palsy (CP) has been limited to date. The editor's choice paper is a mixed methodology study of genetic testing in CP, guided by clinical signs and neuroimaging, identifying phenotypical markers that increase the likelihood of a genetic cause. A multiple stakeholder consensus process leads to the development of a core outcome set to assess the impact of chronic pain on emotional functioning of children with CP. A prospective study finds that preschool pro-social behavior predicts community participation at school age. A validation study of the Visual Impairment Developmental Autonomy Scale finds this questionnaire effective in assessing both the needs and autonomy of children with visual impairment. A comparison study of 3 translated versions of the Paediatric Evaluation of Disability Inventory Computer Adaptive Test, PDCAT, supports validity of these versions in measuring functioning, but some differences call for caution in interpreting results. A retrospective cross-sectional study of seizures in a large cohort of patients with childhood cerebral adrenoleukodystrophy shows relatively high seizure prevalence and highlights seizure onset as a possible indicator of disease progression. Another retrospective cross-sectional study documents the phenotypic spectrum of YWH-AG-related epilepsy, from mild febrile seizures to severe developmental and epileptic encephalopathy.